You're listening to HealthCall Live, the area's only live local interactive radio hour devoted to you and your health. Here's your host, health and wellness correspondent, Lee Kelso.
Good morning. So happy to have you with us here on HealthCall Live. A beautiful Saturday, sunny, 74 degrees right now. We're heading to 87 degrees a little bit later today. It's kind of hard to believe that summer's winding down. Kids are going to be back in school in just a few days. And when you have a child with a learning challenge, man, school can be stressful. We went through it in our family. I feel you if you're having that problem. It's tough for both parents and the student. And it's not uncommon that reading is the most significant challenge and struggle that you're going to face. And in some cases, the answer is visual therapy. When a child's eyes can't focus correctly or don't work together like they should, that single factor can result in just a long list of problems that make success in school really a significant challenge for everybody in the household. And so that's why we've asked Dr. Carl Myers to join us today. He is one of a handful of optometrists in the state of Indiana who specialize in visual therapy to overcome visual deficiencies. Doctor, thank you for coming in.
My pleasure to be here.
So we're not talking about how well a child sees, 20/20 vision, that kind of thing. That's not the problem we're talking about here, right?
In the vast majority of cases, no. Most of the individuals are seeing 20/20 already.
And so we're talking about problems of where to focus, being able to track, and your eyes converging at the right place, correct?
That is correct, yes.
So tell me more about that. What type of vision problems, how do kids who suffer those conditions see? What do they see and experience?
Well, one of the more common problems we work with is a condition called convergence insufficiency, where the two eyes just are not converging or turning inward towards the nose as they're reading very well, or they can't maintain that. And it causes the print to sometimes look like it's moving on the page or jumping around or blurring. It certainly looks blurred too. And they're just unable to track. They may miscall words. They may end up skipping words and lines, a whole host of things which go along with that.
So that causes a nightmarish kind of situation for that child in school, doesn't it?
Yes, they are. They've already perhaps been labeled as having some reading problems or in a special reading group. They're being asked to maybe read more often or longer periods of time. However, when they don't have the tools in their toolbox to read in terms of the eye movements and eye alignment and convergence and focusing, they're just frustrated because they're being asked to do something that they don't have the equipment to do.
Yeah, self-esteem issues arise out of that.
Absolutely, yes.
And so you are a specialist in really what is a form of physical therapy like we might undergo for an injury or an accident, but we're doing this with vision, right?
That's correct, yeah. And it's both in terms of rehabilitation if they have had an accident, but also because vision is a developed sense, lots of times these individuals, kids particularly, have never developed a sense to begin with. So it's not so much rehabilitation as it is habilitation sometimes.
Well, Dr. Myers is our guest for the next half hour, and we'd love to have you be part of the program. If you have a child or a grandchild that's having a vision difficulty, you can always call and ask your questions at 447-1190 or 1-800-333-1190. The phones are open, and we invite you to call if you do have a question. So let's talk about what are some giveaways that my child has not a vision problem, but a how do you refer to it then? If it's not a vision sight, it's sight. It's vision, not sight, I guess is what I'm getting to, right?
That's right. It is a vision problem, however, frequently not an eyesight problem. And the types of problems you'll frequently see is, well, first of all, lots of times avoidance and just performance below expected levels. And they may be very good at lots of things, but when it comes to suddenly the reading process, they seem to really bog down and avoid it. They may be rubbing their eyes a lot. They may be, as I mentioned earlier, losing their place a lot as they're reading. Math is a big area where they may be good at math, but when it comes to a story problem, all of a sudden they fall apart. And the big difference there, obviously, is reading again and eye movements and the visual side of things.
What about clumsiness? If I have a child that just really can't get it together in sports or something like that?
Yes, certainly coordination is something that vision is the guider of. And so, yes, if you see someone who is not developing well or can't hit the ball, can't catch the ball, they just seem uncoordinated as they're walking, bumping into things and so forth. They may be having a problem with depth perception or any number of things.
So we'll talk a little bit more about the sports enhancement therapy that you can do to help players improve just a little bit later on. I want to touch on, if I have a child that has ADD or ADHD, should I make sure that they're not having a vision issue first?
That is a very good thing to do because, as most people don't know, there really is no test for ADD or ADHD, but rather it's done through the observation of various behaviors. And it turns out that many times undiagnosed vision problems can masquerade as an attention problem or as the child will show some hyperactivity in the fact that because they're frustrated, they're wiggling in their chair a lot, and it may look to someone that it is an attentional problem when it may be, in fact, a visual problem that is behind it all.
And you told me that there are some postural cues in the way a child might turn their head or hold their shoulder that can be a cue as well.
Yes, when you see an individual with a kind of constant head turn, or should I say a very habitual head turn, it may be a tip-off that they have an eye misalignment. They may be doing that in order to put the eyes or allow their eyes to be in a posture or direction that is either allowing them better use of the two eyes together, or perhaps they're doing it to, in a sense, block off one of the eyes, using the nose maybe to block off an eye, so they now no longer have the confusion that comes from the double vision that could occur from two eyes not pointing in the same direction.
Okay, so let's assume that I do believe that there's a warning sign in one of my kids, that something's going on, that there's a vision disturbance here. What's that process look like? What happens in your office, and how can you help me?
Okay, we do things in a step-by-step process. The first step, obviously, is to have an evaluation where we look at a whole host of things just to determine whether there really is a visual component to the problems that they're having. Certainly, we look at the history, but we also then do the examination to determine the refractive status, whether they are needing glasses, but also we're looking at eye movements on kind of a cursory level at that point. And then, if we do determine that there are some visual components there, as many times there are because of the fact that people are calling us because they already know that their child is struggling in one way or another, then we will recommend they come back for a second evaluation where we will go much more in depth in certain areas, much more targeted, and then we put it all together and sit down with the parents and go over our findings and how they relate to perhaps the problems that they're observing in the real world with their child.
You have on your website, which is, by the way, IndianaVisionTherapy.com, you have a checklist that parents can walk through, and it's kind of self-scoring. Tell me how that works.
Well, it is indeed on our website, and if they go to the section where it says treatment areas up at the top, that you can then take an inventory of the survey there. I'm trying to think what it is actually called. Is the
like a questionnaire?
Questionnaire, yeah. And anyway, so you can take a survey there. It asks you to just rate whether your child is having things like skipping words or headaches or falling asleep as they're reading or frequently complaining of double vision or any host of different things, watering eyes, rubbing the eyes, closing, covering an eye. There are, I believe, 43 objects or 43 items on that, and some of them are more significant than others, so they are scored. Some of them are 3-point questions, some of them are 2, and some are 1, but it gives you a score and gives you a feeling for whether or not there really is a problem here.
Yeah, things like skipping words while reading, you substitute words while you're reading, you reread words or lines, you reverse letters and numbers, have to use your finger along the way. If you do not write in a typical pattern, you might write uphill, downhill. All those are signs that there could be a visual disturbance.
Absolutely are, yes.
Okay, so that's kind of what you're going to find as you go to the website and go through that checklist for yourself. We have Trina on the line. She's got a question for you. So, Doctor, if you put your headphones on, we're going to see what's on Trina's mind. Trina, you're on with us here on Health Call. What's your question for Dr. Carl Myers?
I have an 8-year-old son who seems to get frustrated with reading. He's a very slow reader. He says that the letters kind of move a little bit on the page. I thought maybe he was just avoiding. He can't read very long before he just gets really frustrated and just gives up. Should his vision be checked?
Yes, that sounds very much like a good number of the patients that we work with every day. These individuals are struggling because of inefficient visual performance, and if they're not able to move their eyes accurately, or as I mentioned earlier, converge or turn the eyes inward as well as they should, or focus the eyes or maintain that level of focus, all of those, among other things that could be going on too, will be leading to lots of frustration, and that then leads to avoidance. We all want to give up on things that we're not being very successful at.
So, Doctor, give Trina a couple of diagnostics at home, something she might be able to do to check on this.
Okay, one fairly easy thing to do, we do in every evaluation, is a test of the convergence. It's one of the tests we do for convergence. That is, take an object like a pencil or something like that. It's better to use an object as opposed to your finger, but actually start to move it in slowly towards the individual, towards your child's eyes, right on the midline toward the nose, and slowly moving it in, not quickly, but and watching their eyes as they turn in. And also, I just ask them, tell me if you ever see two pencils. And as they come inward, then just watch those eyes, and you may observe one eye that all of a sudden just kind of pops out. It loses. You'll be able to tell as they come in when they're watching, and all of a sudden one of them may just kind of give up, so to speak. And it's usually at that very same moment that if the child's being observant, will say, I see two of them now. Sometimes they do, sometimes they don't. But if either they're reporting double vision or you're seeing an eye which kind of pops out, and they should be able to get all the way up to within 2 to 3 inches of their nose before they lose it, before they say, I can't do it anymore. So if you're seeing a child who out there at 10, 12 inches is unable to keep their eyes converged, that's a child who is undoubtedly struggling.
Hey, Trina, does your 8-year-old show any other symptoms, clumsiness or inability to do any other tasks?
He's not real good with spelling. When he's reading, I think he's not remembering what he's reading because he's such a slow reader. So he's a little behind on reading. So.
Yeah, those are certainly things that are tip-off also, because there's an area that we look at and work with called visualization. It sounds both in terms of the comprehension and spelling that there's a good chance there's some visualization problems, which is a visual perceptual problem. I always say comprehension definitely is visual. If it's not, then how come is it when someone explains something to us, we just naturally go, oh, I see. We don't go, oh, I taste. I see. We must form a picture in our mind of what's going on as we read something, or else the game's over. Likewise, spelling. How often do we write something and go, it doesn't look right? Yep. And a lot of times these kids are struggling in these areas, and those are the foundation as to what's going on.
Trina, we've got to run to a commercial break, but on the other side, we're going to talk about some of the steps that can happen in Dr. Myers' office to treat and provide therapy for an 8-year-old like you, or maybe somebody else who's listening. So, Trina, thanks for calling in here on HealthCall Live.
You.
You bet. We'll be right back in just a second. More with Dr. Carl Myers from Indiana Vision Development Center. We're talking about how your child can improve its performance in school by learning to see better. We're right back in just a second on HealthCall Live on WOWO 1190 AM and 107.5 FM. Hey, welcome back to the program. It is 22 minutes past 9 o'clock on a beautiful Saturday morning. You are listening to HealthCall Live. Our guest today is Dr. Carl Myers. from the Indiana Vision Development Center. Just a moment ago, in case you just tuned in, Trina called in and told us about her 8-year-old who has difficulty reading and comprehension issues and some other things. And so I'm going to ask Dr. Myers now to walk us through, if this little guy came into the office and we think he might have vision convergence issues, tell me how you're going to treat this little guy.
All right. Of course, we've already talked about the examination process, and then we're going to begin therapy, which is generally done once a week in our office for about an hour-long session, one-on-one with one of our therapists. We're going to first start to work on the eye movements. Because vision is a developed process, we have to start at the foundation, and eye movements are the very foundation of the visual process.
What does that mean? How are you going to work on eye movement?
Well, we're going to work one eye at a time to begin with. We're going to make sure that they're able to smoothly track and follow with their right eye and then with their left eye, and they're able to change fixation quickly and accurately from one point to the next. That's obviously important in the reading process. Then we're going to begin doing it with both eyes together, and then we're going to begin to add in some things like the focus change, being able to change focus quickly and accurately from distance to near. And then we're going to begin to work in some of the what we call fusional skills, the ability to keep the two eyes together so that they're not drifting apart when we're having a near demand like reading or something there.
And so you're going to give me exercises to do at home, I assume?
That's correct. There's also home activities that we generally ask that the patient do about 20 minutes 5 times a week at home to kind of support what we're doing in the office. I always say it's kind of like piano lessons. If you can you take the lesson but don't do the home practice, it's tough to get better very quickly.
Sure. So as you work through these things, you're training my brain to do what?
Basically, we are just kind of building some new synapses or connections in the brain. It's just learning. We are learning how to use the visual process, the eyes and vision, to solve our problems that are out there. And they're not sometimes thought of as problems, but we have the issue. I have to be able to change focus. I have to be able to keep the focus and so forth. So it's just a matter of basically training the eyes and the whole visual process to work together.
So I'm going to go through several months to a year's worth of therapy?
It varies a great deal as to how many problems are going on. It's very frequent. It's not that the individual won't have just one problem, but have a couple different things going on. But most of our programs range from about 6 months to a year, so about 6 to 12 months. We have some that have been shorter. We have some that have been longer. But it just varies depending on the complexity of the issues.
And then am I going to have this therapy again periodically through my life? Am I going to regress after I make some progress?
Very seldom is there any regression. In fact, we do a recheck of all of our patients after they finish 3 months after they're done and 6 months after they're done. But regression is very rare. I always say it's like if you think about riding a bike. Once you learn to ride a bike, you don't have to practice learning riding a bike every day. And, it's been a long time since I rode a bike, but I know I can do it. And if we're not going to lose a skill like riding a bike, how much more are we not going to lose a skill like reading and the eye movements, because they're practicing them every day.
Yeah. Yeah, you do it all the time and you don't even think about it, right?
That's sure. Right.
So we did not yet talk about something that I think is going to be of interest to some people, and that is improving vision for sports enhancement. So even though I may not have a visual deficit, you can help me get better in sport?
Yes. There are a good number of professional athletes and athletic teams that have optometrists similar to myself on their staff, or at least on a retainer basis. Many professional athletes have benefited from vision training, not just the professional, but the collegiate level and even high school level. We can do things to improve free throw shooting percentages by where are they looking when they shoot. But there are, like Larry Fitzgerald of the Arizona Cardinals has been a big supporter of vision therapy in the sense that he had it as a child himself to help some of his learning issues, but now he continues to do it to this day to improve his ability to perform on the field, and particularly in the elite college level and the professional athletes. that extra little batting percentage rate can be millions of dollars to them. So they are very interested in keeping their visual process in tune.
We're winding down. I do want to touch on one other thing here. You told me something I was a little surprised at. If I have a child with an eye turn, one eye that's cocked askew, don't be too quick to rush into surgery.
Yes. So often that seems to be the first approach that a lot of people want to take. But when they straighten an eye with surgery, first of all, they don't always get it completely straight, but moreover, it may be straight in what we call primary or straight ahead gaze, but when they look to the sides, the left or to the right, the eyes may no longer be aligned because of the relationship of the muscle and the eyeball that's been created from that. And so it's much harder. We can work with those individuals in terms of training them, but it is much better to take a approach that is more developmental in nature, as we do first, and then if surgery is needed, that's something that could be considered later.
Okay. So how young can you start working with a child?
We can actually start very, very young. We have a program in the office that is called the Infant C program, where we see individuals at 6 months of age to 12 months of age, and we're looking for things like eye turns, obviously there, or big differences in prescription. We can give that individual already at 6 months of age, who can give the parents some things to do at home with them to help them develop that visual process that is needed.
Vision is so important. It plays such a huge role in the success of a child and their development into a good human being. And I hope that if you have a child you have some concerns about, you will drop into Indiana Vision Development Center. You can find them online at indianavisiontherapy.com. Dr. Carl Myers was our guest in this half hour. Thank you so much for being here. We hope we helped some people today.
It's been a pleasure being here.
I am so glad you were here.